33 million. That's how many leeches France brought in from outside its own borders in a single year by 1827. Not caught, not farmed, imported, because the country had already run out of its own. Give it 5 more years, and that number climbs past 50 million. You read that right. 50 million living, blood-drinking worms, crossing borders in barrels and jars and damp sacks, in a single 12-month stretch, to satisfy a demand that no domestic swamp could keep up with anymore. Sit with that for a second, because it doesn't sound like a supply chain. It sounds like an invasion, run in reverse. A country importing the thing everyone else in history spent their energy trying to avoid. You've probably never touched one on purpose. Most people haven't. The mental image is instant, and it isn't flattering. Something dark and glistening and legless, pressed flat against skin, feeding without asking. That reaction is old. It's basically hardwired, and in the 1830s, that exact creature was worth more, pound for pound, than almost anything else moving through European commerce. Not gold, not spice, not textile, a swamp parasite. Apothecaries in France were paying prices for leeches that, in some records, ate up close to 1/10 of an entire hospital's annual budget. One institution in London, St. Thomas's, went from using a little over 1,600 leeches a year to more than 50,000 in under a decade. That's not a gradual rise. That's a hospital's leech consumption multiplying more than 30 times over inside 10 years. And somebody had to catch them. There was a real profession built around this. Leech gatherers, mostly rural, mostly poor, who waded barefoot and bare-legged into marshland and let the leeches attach to their own skin, because that was the most efficient lure available. You stand in cold water for hours. You let dozens of blood-feeding animals fasten onto your legs one at a time. You pull them off, drop them in a jar, and wade back in. That was a job. People did that job every day, for money, because the demand from the cities was that intense. If you'd been born in the wrong village at the wrong time, this might have been how you fed your family, your own blood, traded in small increments to keep an entire continent's medical system stocked. Here's what's strange about all of that. The same decade that saw millions of leeches shipped across borders like a commodity, like coffee, like cotton, also saw the wild population of the medicinal leech collapse so hard across parts of Europe that naturalists at the time were openly worried the species might not survive its own popularity. France went from a country that exported leeches in the 1820s to one begging for imports by the 1830s, because its own marshes had been stripped bare. A creature people were paying more per unit than a laborer's daily wage suddenly had a fight for survival problem, caused entirely by the humans who wanted it. That's the paradox sitting right at the center of this story. An animal loved almost to extinction by the exact civilization that also, on sight, found it repulsive. Think about what that actually requires. It requires that revulsion and value weren't opposites here. They were sitting on top of each other the entire time. Nobody in 1830s Paris was petting a leech. Nobody thought it was cute. And they still built farms for it, argued over import tariffs on it, spent a chunk of a national medical budget on it, and pushed it toward local extinction because they needed it that badly. You don't do that for something you merely tolerate. You do that for something you've decided you cannot function without, even while you find it disgusting to look at. To understand why anyone would let a swamp animal get that valuable, you have to go back a lot further than a French marsh in the 1830s. You have to go back roughly 3,500 years to a set of ideas that had nothing to do with leeches at first, and everything to do with a theory of the human body that turned out to be almost entirely mistaken. The idea was simple enough to survive for millennia. The body ran on 4 fluids called humors: blood, yellow bile, black bile, and phlegm. Health was balanced between them. Illness was one of them, running high or low. And of the 4, blood was treated as the one most likely to build up in excess, especially in spring, especially in the young and the vigorous, especially in anyone with a fever, a headache, a fainting spell, or almost any other complaint a physician couldn't otherwise explain. The fix, according to this framework, was obvious. Remove some blood, restore the balance. That single idea, drain the excess, is the thread connecting Egyptian healers, Greek physicians, Roman doctors including Galen, and eventually the entirety of European medicine for the next 2,000 years. Bloodletting wasn't a fringe practice tolerated by a few eccentric healers. It was mainstream medicine, prescribed for plague, for smallpox, for epilepsy, for gout, for hypertension, and for simply staying well during the wrong season. If you were sick almost anywhere in the Western world for the better part of 2 millennia, there was a real chance someone was going to open a vein or set a leech on you before they tried much of anything else. For a long stretch of that history, the tool of choice wasn't even the leech. It was the blade. Direct venesection, cutting into a vein and letting blood run into a bowl. That method had its own strange chapter in medieval Europe. In the year 1163, a church council in Tours forbade monks and priests from performing bloodletting, a practice they'd overseen for centuries as part of monastic medical care. Losing their in-house physicians didn't reduce demand for the procedure. It just handed the job to a new tradesman, the barber. For the next several centuries, the person cutting your hair might also pull your tooth, stitch a wound, amputate a limb, or bleed you with a blade, all under the same striped pole that to this day is a leftover symbol of that blood-soaked side job. Leeches offered something the blade couldn't. Precision, for one. A leech could be guided with a small tube to a very specific point on the body, targeting the area a physician believed was inflamed, rather than opening a general vein and hoping the excess drained from the right place. And the bite itself was close to painless, thanks to compounds in the leech's saliva that numbed the site as it fed, which made the animal, ironically, gentler on the patient than the barber's blade ever was. That gentleness is part of why leeches eventually overtook the knife as the preferred method. By the 1820s, a French physician named François-Joseph Victor Broussais had built an entire medical philosophy around the belief that inflammation was the root cause of nearly every disease, and that leeching the inflamed area, sometimes with dozens of leeches applied to a single patient over the course of a few days, was the cure. Historical records describe treatments using more than 100 leeches on one patient across a handful of days. Broussais became one of the most influential physicians in France. His theory, and his appetite for leeches, is a direct line to the numbers that opened this story. None of this worked the way anyone believed it did. That's the part worth sitting with, because it's tempting to tell this story as an ancient wisdom that modern medicine simply forgot how to appreciate. It wasn't wisdom. Bloodletting, by and large, didn't cure the diseases it was prescribed for, and in a meaningful number of cases, it made the underlying condition worse, weakening patients who were already fighting an infection or an illness by draining the one resource their body needed to fight it: blood itself. Physicians of the era had no concept of blood volume, no understanding of shock, and no real diagnostic method beyond humoral theory to tell them when they'd taken too much. The result was a medical practice performed with total sincerity, on an enormous scale, that was frequently indifferent to whether the patient survived it. So when this chapter's opening reaction to a leech was disgust and unease, that reaction wasn't a historical error waiting to be corrected. It was, in a real sense, earned. This was an animal bred, farmed, and imported by the tens of millions, specifically to be pressed against sick and vulnerable people, as part of a medical tradition that spanned nearly 2,000 years and rested on a theory of the body that was fundamentally wrong. Leeches were not innocent bystanders, swept up in a misunderstanding. They were the delivery mechanism for one of the longest-running errors in the history of medicine, an error so entrenched that even into the early 20th century, some physicians were still prescribing bloodletting for cardiac conditions, despite mounting criticism from within their own field. That criticism did eventually arrive, and it arrived from inside medicine itself. In 1828, a French physician named Pierre-Charles-Alexandre Louis became one of the first prominent voices to openly challenge bloodletting as a treatment, using something bloodletting's defenders had never systematically applied to their own practice: comparative data. Louis tracked outcomes across patients who were bled and patients who weren't, and the numbers didn't support the theory that had justified 2 millennia of the practice. It took decades more for that skepticism to fully take hold, but the crack had appeared. The Leech mania that peaked in the 1830s was, in hindsight, closer to the last full-strength gasp of an idea already being questioned than the height of a stable, permanent medical consensus. That reason arrived in an operating room, not a marsh, and it had nothing to do with balancing anything in the blood. It had to do with keeping blood moving through tissue that had just been surgically reattached to a body it had recently been separated from. Reattachment surgery, taking a severed finger, a severed ear, a piece of skin lifted for a graft, and reconnecting it to a living body, sounds like it should be a single problem. It isn't. It's two separate problems, and only one of them is hard because of the reason people usually assume. Arteries, the vessels carrying fresh, oxygenated blood into the reattached tissue, are relatively forgiving to repair. They're muscular, they're under real pressure, and a skilled microsurgeon can often reconnect them with fine sutures and get blood flowing back in within a workable window. Veins are the problem. Veins are thin-walled, low-pressure, and far more delicate to suture back together, and in a lot of reattachment cases, surgeons simply cannot reconnect enough of them, or reconnect them successfully enough to let blood drain back out of the tissue at the rate it's flowing in. The result has a name: venous congestion. Blood keeps arriving through the artery, and it has nowhere adequate to leave. It pools. The tissue swells, turns purple, then a deep blue-black, and starts to die. Not from lack of blood, but from too much of it, trapped with no way out. This is the single most common reason a reattached finger, a relocated tissue flap, or a skin graft fails after otherwise successful surgery. The hard part was never getting fresh blood in. It's getting the old, oxygen-depleted blood back out fast enough to keep the tissue alive while the body slowly regrows its own venous drainage, a process that can take several days. There is no mechanical pump built that reliably solves this. That's not a dramatic exaggeration for a documentary. It's the specific, stated reason this problem has remained a genuine limitation in reconstructive and microsurgery for decades. You can suture an artery with confidence. Rebuilding adequate venous drainage in tissue that's swollen, delicate, and days away from healing on its own is a different kind of problem, and it's one where surgeons needed a tool that could do something continuous, controlled, and biologically active, not just mechanical suction. Which brings the story back to the bite itself, and to what's actually happening inside it. Remember that near-painless quality from the last chapter, the one that made leeches gentler than a barber's blade. That sensation isn't an accident of anatomy. A medicinal leech's saliva is a genuinely complex cocktail. It contains a local anesthetic, which is why the bite barely registers. It contains a vasodilator, which widens the blood vessels at the site to keep blood flowing freely into the wound rather than clotting it shut. And most importantly, it contains an anticoagulant called hirudin, first characterized scientifically in the 1880s, which prevents the blood at the bite site from clotting, not just while the leech is actively feeding, but for several hours after it has detached and left entirely. That last detail is the mechanism that matters here, and it's worth being direct about it. This is not the leech draining a meaningful volume of blood from the body the way an 18th century physician imagined. A single leech feeding will typically take in a modest amount relative to the patient's total blood volume, engorging itself several times its own body weight before releasing. The therapeutic effect isn't the withdrawal, it's what happens afterward, when hirudin keeps that specific site oozing and draining for hours, giving swollen, congested tissue exactly the kind of slow, continuous decompression that a clogged venous system desperately needs, and that no clamp, pump, or drain can replicate with the same precision. The leech isn't removing blood from you in any way that matters to your overall system. It's opening a controlled, biologically maintained release valve on a single point of tissue that's drowning in blood with nowhere to go. Surgeons had actually rediscovered this decades before it became mainstream. A published account from 1960 described using leeches in plastic surgery, and through the 1970s, 80s, and 90s, the technique kept resurfacing in microsurgical case reports, quietly, almost embarrassedly, as doctors found that this animal, discredited, abandoned, historically associated with 2,000 years of medical error, was solving a problem their instruments couldn't. Clinical reviews eventually built out the actual numbers. Wild-sourced leeches used under antibiotic cover were shown to raise flap and graft success rates significantly, with some clinical case series reporting improvement in salvage rates by wide margins, compared to congested tissue managed without them. What had been missing for most of that quiet resurgence was any kind of formal regulatory recognition, and that's where this chapter arrives at its hinge point. In June of 2004, the United States Food and Drug Administration cleared hirudin medicinalis, the medicinal leech, as a medical device, specifically a prescription Class II device, the same regulatory tier that governs equipment like surgical sutures. A French company, Ricorimpex, became the first to receive that clearance, under an application number the agency still lists in its records. The stated indication, in the clearance documentation, was narrow and clinical, an adjunct to the healing of graft tissue when problems of venous congestion may delay healing, or to overcome that congestion by creating prolonged, localized bleeding at the site. Sit with what that clearance actually means. This wasn't a wellness product. It wasn't an herbal supplement squeezing through a looser approval pathway. The FDA looked at a living organism, bred, farmed, fed, and applied directly to a human wound, and classified it using the same legal and safety framework applied to pacemakers and surgical implants. That had never happened before for a living creature, and outside a small number of specialized regulatory carve-outs, it hasn't happened since. The agency wasn't nostalgic about bloodletting history when it made that call. It was looking at accumulating clinical data on flap and graft salvage and concluding that this specific organism, used in this specific way, met the bar. Every leech used in that clinical context today is a single-use device in the most literal sense. It's raised on a sterile, regulated biofarm rather than pulled from wild marshland, applied to exactly one patient, and never reused, largely to eliminate the infection risks that plagued wild-caught leeches for centuries. The same risk, in a different form, that once made barber-surgeons and apothecaries such dangerous middlemen in the story you already know. The animal is the same species that nearly vanished from European wetlands under the weight of Broussais' leech mania. The saliva is doing something closer to what it was likely doing for hundreds of millions of years before any human ever picked one up, keeping a feeding site open and flowing, so the leech could get a full meal off a host that didn't realize it was being fed on. Modern surgery didn't invent a new use for the leech. It found a narrow, precise, evidence-backed application for a mechanism the animal had already perfected for reasons that had nothing to do with human medicine at all. Picture the actual room this happens in, because up to now this has all been mechanism and history, and the mechanism only matters at the bedside. A patient comes out of reattachment surgery. The finger, or the ear, or the flap of relocated tissue looks fine at first, pink, warm, the artery clearly doing its job. Then, sometime in the next few hours, the color starts to shift, purple at the edges, a texture that looks tight, almost swollen from the inside. A nurse checking on the site every hour is watching for exactly this, because the window to intervene is short. Left alone, that discoloration deepens, the tissue stiffens, and within roughly 1 to 2 days it's dead. Not from the surgery failing, but from the drainage problem this documentary already walked through, now playing out in real time on a real patient's hand. This is the moment the leech gets called for, and in surgical centers that keep them on hand, it isn't treated as a last resort or a novelty. It's treated as standard of care. A single leech is placed directly on the congested skin, at the exact point closest to where drainage has failed, and left to attach. It feeds for perhaps 20 to 45 minutes, then releases on its own, and then the part that actually matters happens. The site keeps bleeding, slowly and steadily, for several hours afterward, because of the anticoagulant left behind in the tissue. That slow ooze is the therapy. Nurses will often need to help the wound keep bleeding at a controlled rate during that window, sometimes reapplying warm compresses to encourage it, because the entire treatment depends on that site staying open exactly as long as the tissue needs it to. Multiply that single bedside moment by every microsurgical center running a Leech protocol, and you get something close to a hidden layer of modern hospital infrastructure. Academic medical centers with active reconstructive and microsurgery programs keep medicinal leeches stocked and ready the way they'd stock any other perishable surgical supply, because venous congestion isn't a rare complication. It's one of the most common reasons a technically successful reattachment still fails in its first few days. Pull the leech out of that supply closet, and you don't just lose a treatment option. You lose the primary rescue method for a failure mode that has no equally effective mechanical substitute, which means a measurable share of replanted fingers, ears, and free flaps that are currently salvaged would instead be lost. That's not a hypothetical. It's documented in exactly the blunt way medicine measures these things. Case series comparing congested tissue treated with leech therapy against tissue managed without it, tracking whether the graft or the digit survives. The improvement in salvage rates in those comparisons isn't marginal. It's the difference between a surgical team having a real answer to venous congestion and having none. And every one of those leeches, remember, comes from a sterile, regulated biofarm now, not a marsh, not a barrel crossing a border, not a barefoot gatherer wading into cold water the way this story began. The species, nearly erased from European wetlands by its own overwhelming popularity, is now deliberately bred in controlled facilities, specifically because hospitals cannot risk running short, and cannot risk the infection exposure that came with the old wild-caught supply chain. In a strange, quiet way, the exact vulnerability that nearly finished this animal off in the 1830s, a demand outpacing what nature could replace, has simply been solved this time with farming instead of extinction. The demand never really went away. What changed was the reason for it, and the infrastructure built to meet it without repeating the collapse. There's a version of this story that ends cleanly right there. Misunderstood creature, redeemed by science, medicine finally gets it right. That version would be tidy, and it would also be a little dishonest, because it skips past something worth sitting with. The leech didn't stop doing the thing that made it unsettling in the first place. It still attaches to skin without asking. It still feeds on blood, still leaves a wound that keeps bleeding well after it's gone. The reaction this documentary opened on, the discomfort, the instinct to recoil, is not something modern medicine disproved. It's still the correct, accurate response to what this animal actually is and does. What changed is not the leech. What changed is that a very specific, very narrow slice of human tissue trauma turned out to need exactly that behavior, applied under exactly the right conditions, at exactly the right moment. And even now, there's more here that isn't fully settled. Hirudin was isolated and characterized well over a century ago, but leech saliva itself is a genuinely complex mixture, and researchers are still working through what else is in it. Compounds beyond the anticoagulant and the vasodilator, some with antibacterial properties, some whose full function in human tissue isn't completely mapped yet. The leech that sits in a hospital's supply room today is doing a job medicine understands well enough to regulate, prescribe, and rely on. It is not a job medicine claims to understand completely. So go back to that opening number. 50 million leeches in a single year, crossing into a country that had already stripped its own marshes bare. An economy built entirely around an animal most people wouldn't willingly let near their skin. That number was never really about a misunderstanding waiting to be corrected. It was about a civilization that found this creature repulsive and could not stop needing it, for reasons that turned out to be almost entirely wrong for nearly 2,000 years. And then, after the theory collapsed and the demand vanished, and the species nearly disappeared along with it, turned out to have been onto something real the entire time, just not in any way anyone at the time could have explained. It's not a good animal. It's not a bad one either. It's the same swamp organism it always was, doing the same thing it has always done. And depending entirely on the moment you meet it, that can be the reason a limb doesn't survive, or the exact reason it does.